allowing myself and Dr. Henry to come and do a presentation for you, and also to Chris and Keith and Sue for inviting us, giving us a special invite. Hey, we are representing a company called Afrivet. We've been in Zambia now for, I think, the better part of 24 years. Time has really flown. Our core business has been importing and distribution of veterinary pharmaceuticals, and my specialty being ruminants. We did a lot of consulting work to the industry. Over the years, we've provided quite a bit of insight into bull testing, something that's not very common in Zambia, I must say. On the commercial side, we do some regular bull testing, but on the communal side or small scale farmers, we've done very little or no bull testing. Just as a matter of introduction, I would like to say that in the years that we've tested, we might have done in the region of about 2,000 to 3,000 bulls fertility testing every year, at least, and we might have had a failure rate of about 5%. Now, 5% sounds very low, but we've had farms where tested 80 bulls, 5%, no problem. We had farms where we tested 10 bulls. He's got 10 bulls, we tested 10, 8 failed. So don't look at the 5% and think that it's a very small amount, and if I just add more bulls, I'll solve my problems. So I'm coming in from that angle, and Henry just turned up. This is Dr. Henry. He's my old-time colleague. We've been working for many years together, testing bulls all over the country. And so we're going to do the presentation in two parts. I'll speak, and then Dr. Henry will speak as well. Okay, so there's going to be quite a bit of which is the best bull. I think the first presentation also spoke about the same thing. Our job as veterinarians is to give you a bull that's functional, of a breed. You can change it. You can see there are all the 4 pictures I've shown you, 4 different types of bull, all are Santas, politically correct for today. The big question is, how do you choose a bull? A lot of times farmers will call us, okay, I'm going to the bull sale at the showgrounds, can you please come and help me to choose a bull? We can give you a certain amount of advice, but the point that we as veterinarians come from is a lot more different from where a breeder will come from. So I say all breeds are good. All breeds are good, it's your choice. As long as you have the passion for the breed, you'll do well with the breed. What we must also know that all breeds have strengths and they all have weaknesses. You need to identify those and work with them. Because the breeds have strengths and weaknesses, what we have seen is the formation of synthetic breeds, and the Santa Gertrudis being one of them, where you've got a 3/8 Brahman and 5/8 Shorthorn cross to make up the breed. Bonsmara is another example, your Beef Master is another example, and there's quite a few coming up now. So just trying to get onto the back of the first speaker, you get different types of bulls within breeds, maturity types. So all these are the factors, I'm not going to go into it, but that you should, as a bull buyer, know that there are maturity types. And you need to study these and understand them, and then you can make your choices. So when you do buy a bull, as you see, most of the bulls that are up for sale today, I think there are one a few ages that I've seen were within 3 to 4 years old. That's a good age to buy a bull. If you can buy them earlier, even better. Allow them to adapt. Remember, farms are not the same all over the country. Cattle by nature are ruminants. Ruminants need to eat grass, and to eat the grass they need microorganisms. And as you move an animal from one area to another area, it needs to adapt again to start to be able to utilize the roughage in the new area. So buy your bulls early, and if you are going to buy an old bull, And this I see whenever I go to the southern province to some of my friends in Namwala and Choma. They'll be buying somebody's old bull and asking, well, why did you buy it? But this bull has produced such good calves. And now he's 8, 9, 10 years old. Knees are packed in. The scrotum is almost touching the ground. But so this is what they are buying. Am I right? Good. So try and get your bulls young, because we've seen the graph, what an impact of a bull is on a herd. I'm not going to spend too much of time on this slide, just to show you there's a big difference between maturity types. You get within the breed, there are maturity types. You will find that the earlier maturing breeds, they get rounder, they grow, they have a smaller frame, but they're maturing faster. They have they reach their scrotal circumference faster, they round off faster, whereas the later maturing breeds will be the direct opposite of it. They might be heavier, but they'll take longer to get heavier, and they'll take longer to get mature. So our focus today as veterinarians here is, what is fertility? You can't just go and look at a bull and decide, I like this bull. Yes, there is confirmation. You meet your confirmation criteria, that's the first step. The second step, after you've decided this bull has got a good back and he's got a good mouth and he's got a good hind quarter, we've passed that step. The next step is, does he have libido? You'll be amazed how many bulls lack libido, either naturally or by dominance. Dominance means there's another bull that's more superior and he just moves them out, and these other bulls that you want to use cannot work. So libido is very important. And for determining libido, you need to observe these bulls. There are tests that can be done. We have tested them that way as well. Stick in a few females and watch the reaction time. He doesn't have to mount, but you need to see if you give him a heifer, even if she's not in heat, give him a heifer to look at. And if he starts getting excited, this guy has got it. Not one that turns in the opposite direction. So these are the things that we should be looking at in a bull. And then the next step, and this is the most important step, is, can he fertilize? He might have a libido, but if he's firing blanks, it's of no use. So we need to look at his semen quality. We need to look at the viability of that semen. Sometimes they produce semen. We've had many cases, Henry and myself, where we'll collect the full volume of semen, everything is dead. Or you collect the semen, it's got a lot of defects, and he's going to discuss all that with you when he comes to speak. So, in summary, a bull is not just look at confirmation, which we have been doing. Unfortunately, in Zambia, we've been handicapped to a point where a lot of our sales are based on eyesight, as it was mentioned before, color, eyesight, length of the ears. But we are getting it. Now with the education, hopefully in the near future, when you buy a bull, whenever we test the bull, we give a certificate that to say that we've examined the semen, we've examined this bull, he can walk, his legs are good, he can walk, he can eat free of disease, and then we give you a certificate for that. So I'll just hand you over to Henry. He wants to take you over to the next part.
So, sorry to bother you, but I would like to tell you that April is Autism Awareness Month. So, hello to all those who know about autism, and I'm an advocate for that. I will go on and speak about bulls now. Up to this point, we have selected the bull by sight. We have selected it based on the amount of beef it might produce. And we are trying to decide now if it has the necessary equipment to deliver that ability into the next generation. Now, at that point, you start with its physical traits, but in the aspect of the reproductive system, which is now the scrotal circumference. Now, we never pass a bull that is below 30 centimeters, regardless of which breed it is, because for a bull to be sexually mature, it must at least reach that scrotal circumference. So there is a correlation between the size of the scrotum the sperm that will be produced, the maturity of the heifers that it will be produced later on after, and different breeds will reach that early at different ages according to how it was explained earlier. Please, next slide. The bull has got, most people know where, has got different parts that make it produce the sperms and pass them on to the female. Now, the little pink snake-like looking thingy, that one which goes off and turns there and goes there, is the penis that is seen outside. Now, functionally, you can have a bull that cannot remove the penis because it has to unfold out. It doesn't get bulged like the other species that you might be familiar with. It just stretches out. So if it is tied up inside because of injury or a defect when it is born, that won't happen. Now, I'm using that as a good example because what we check for when checking for fertility is a lot more than that. We will look at the testicles, if they're moving inside the sac. Are they mobile? Are they symmetrical, left versus right? Are they twisted? Is there a problem with blood supply to them? Because you need blood to reach there in order for it to actually produce the sperms. You need to check if there is the part up there that produces the fluids, the seminal vesicles, the prostate. Are they inflamed? Are they not? Are they doing their job? Now, once we verify that it has the right equipment and everything is working and the individual aspects that make up the reproductive system of the bull are working, then we still have to look if what is being produced in that is now also viable. It is alive, moving, and can do the job of fertilizing when it is put in the female. So now, the bull has got ability, has libido, it looks at the female, chases them, it can manage to jump and put the penis inside. I think I'm allowed to say penis for the farmers. Can insert it adequately and can deliver sperm. Now, does it have the sperm? So then we do our testing. Now, when we do our testing, we use either by hand, but usually in our case, we use an electroejaculator. We get the sperms out, get in a little tube, and when we see it in the tube, we look at its color, its consistency. So mostly it will be creamy or in consistency. Is it thick? Is it light? Is it yellow colored? And all of those things tell us something about the factory, where it's coming from, and what could be wrong with it if we have to know that, or if there is a problem. And then we then check if the tube that we get of sperms has got more than 75% normal sperms. I'll explain more about what a normal sperm is on the next slide, but for now, we need to know that there are more than 75 normal. And if they're defects, what proportion are those defects? What kind of defects are they? Depending upon what kind of defects the sperm has, we will know if the problem is it in the testicles when they are being made? Is it somewhere in the pipes, or one of the pipes is called an epididymis? Is it in the epididymis where they're maturing and they didn't mature well? And we can identify also where the problem is. There are also some diseases that affect sperm, and we can see what kind of defects are associated with that. And we have to identify the types of defects for that reason. Next, please. Now, this is what a normal sperm would look like, and it is important to realize that that thing needs to be moving in order for it to actually go and fertilize the egg and make a calf. Now, we look at it in that context. It has a head there, it has a meat piece in between, the little round one, the purple one, and it has the principal piece and the terminal one. And each of these can have different kinds of defects. And if, remember, we are coming from more than 75% normal, if less than 75% of the sperms look right, then the bull is not fertile. It can have the right conformation, the right appearance, the right looks, it can chase the females, it can mount, it can release the fluid that you look at. But if the things inside it are not looking the way they should look, they are not formed the way they should form, it won't make the female pregnant. And that brings us to the next slide. Some of the defects that you see, this would be something like what you'd see. And all of those we got tails, little bubbles on the end, tend ones, different defects that are here, bubbles in the center and all of that. If you look at a slide like this, and when we say percentage normal, you see them, they're like two sperms that are normal there towards the right, up there and down there. That one and the one below there. The rest are not normal. This bull would be failed. And you would have to either, depending upon the cause, you most likely have to cull him. And if you put such a bull to your heifers, no matter how good he is, no matter how much you paid for him, you will not have calves because there's nothing inside the bull to make the calves. And even when this is right, then you get the bull tested, and it's like she advised, every year you must have a bull testing before you put him in for breeding. And even if you do that, there is now the other things that you have to take into account. So let me summarize how I've gotten to here, then Dr. Moosa will come back and do that. So we have looked at the bull, we have chosen the breed according to our preferences, we have gone and selected based on the qualities that we need, and then we have gotten to the point where we have tested and the bull is functional, it has libido and everything. And we think it's going to be good. And then there is the last part. Every animal can get sick. And there are particular diseases that affect fertility and reproduction. And those are the last part that Dr. Moosa talked about.
Diseases that affect reproduction are quite a few. And again, I have to say this before I start the discussion, and that is in Zambia currently we are not testing. We are not testing any bulls for the important diseases that affect fertility in bulls. Why? Our labs are not geared up yet. The other reason is the importance has not been highlighted, mainly because the majority of the cattle are bred the whole year round. So when you breed the whole year round, you will not see the impact of some of these venereal diseases. So the first one is very important because this we all experience, and that is any disease that causes a high temperature. If your bull has denkete, if it had lumpy skin, if it had anything that caused the high temperature affects the thermoregulation. Oh, let's put it this way. If there's a high temperature, the semen producing areas are affected. So you will get either no semen, defective semen, or just non-viable semen. And after every episode of a high temperature, you can almost need to wait about 30 days before that guy is back to normal again. So that's a whole month after he's had, say, East Coast fever or red water or hot water or pneumonia or HS before he becomes back to normal fertility. That's just to talk about the effect of high temperature. Now, these are the diseases I'm talking about. These two main diseases, I've grouped them together because the symptoms that they show are quite common. So the first one is called trichomoniasis, and the second one is vibriosis. Normally, even in South Africa, I know, Botswana and Namibia, if you buy a bull, it comes certified free of Vibrio and trikes. You will buy a bull, it will be free of Vibrio and trikes. Unfortunately, in Zambia, we still don't test for that. This is a venereal disease, and you know venereal disease, cow to cow, via the bull, right? Cow to cow via the bull. The main way of spread. What you see is that you get what we call early resorptions. Early resorptions means within the first 2 months, the cow will get pregnant, and then she just throw off the embryo. At this stage, you don't see it because it's so small. Sometimes it's just a light discharge that's coming out, or sometimes nothing at all. The cow will go off heat. We think she's pregnant, and then after 4 or 5 months, she's back pregnant again, or coming on heat again. And this is at least one of the advantages of this disease is once they pick up this infection, most of them clean themselves and they get an immunity to the disease. So with both trichomoniasis and vibriosis, once they've had an episode, most of the cows will self clean themselves and have a natural immunity thereafter. But there are certain cows which are carriers. So these carriers, I think I put it there, it's about 1% of the cow herd would be carriers, and these now will infect your new bulls as they come into the system. Those new bulls will catch your new heifers, and it will just carry on and carry on and carry on. How do we diagnose this disease? It's done by what we call a sheet wash. Basically, we need to go in from the prepuce, and we put in the fluid, and we're supposed to really give it a massage. There's instruments these days that we use as well to scrape, and you collect a sample. That sample is meant to go to a lab. It's supposed to be cultured, and after culturing, they will give you a result, positive or negative. To be 100% certain, some farmers will require 3 tests, especially for trikes. For trichomoniasis, 3 negatives before they will even consider buying a bull. On young virgin bulls, not a problem. Older bulls, because of the conformation of the prepuce, you get all these nice folds. It's the bugs are hiding in those folds. So an important disease, if there's anybody here that's of influence with our big powers that be, we should be testing for this disease. This one is an erosion. This is eroding our calf crop every year. As I say, most of our small-scale farmers or communal grazing farmers don't see it because the bull is there the whole year round. Cow gets pregnant, she throws off the fetus. Then you'll see she conceives about 4 or 5 months later. Then she produces a calf. You're happy. But from one calf to the next calf is almost 1.5 to 2 years now. And that's not economical beef production. So something to look at. Whoever can help us to start enforcing this as a regulation for bulls, it will help us to get to our how many $1 billion beefing the exports that we are trying to get to. Okay, so these are these 2 diseases, very important, and I have just skimmed through it because I'm trying to highlight the importance of this disease. There's lots of technical information on this. If ever you want to come to us, we can discuss it with you. Okay, the last point is we used to have a vaccine for Vibrio and trike as a combination. Unfortunately, we don't have that anymore. The only thing we can get is a Vibrio vaccine. But unfortunately, that is also not registered in Zambia right now. So that's another challenge that we are having. The registration of some of these very crucial vaccines. Something to look over here. BVD, for want of a better description, I call it the AIDS of cows because it's there, but you don't see it. It causes infertility again, causes abortions. You can get these mummified fetuses and also lots of congenital abnormalities. I've had farms in Zambia where I found, when we first found the disease, where the calves were born without eyelids, no eyelids. We've had calves with, what would you call it? No, hydrocephalus, the big swollen heads. We've had calves with abnormalities in the legs. So these are depending on the stage of pregnancy and at what stage the virus got into the body is when you'll see the different, whether it's going to be just a resorption, whether it's going to be an abortion, whether if it catches them later, it causes congenital abnormalities. And then there's diarrhea, I think, is actually a misnomer for this disease. This is how I presented when it was first diagnosed, but diarrhea is one of the smaller problems. Respiratory issues occur where the immunity drops and then they pick up all the secondary bacterial infections. Direct transmission again, direct transmission from the fluids, whether it's aborted fluids, whether it's nasal secretion, whether it's saliva. We need to diagnose the carriers of this disease and then build up a routine vaccine program against this disease. At least for this disease, we do have vaccines that are registered in Zambia. There's one photograph I want to show you, and this is, if you've got, say you've got 50 nice yearling animals on the farm, and you see one that's looking like this is a carrier. 9 out of 10 times, if you test this animal, you'll find that this cow is a carrier for BVD. And it got affected late in the pregnancy, with the result, she is now growing up. This is what they call a runt. Uh, okay, Henry. Okay, the next disease, most of you have heard about it, brucellosis, contagious abortion. Um, Probably the one of the reproductive diseases, at least you can talk to most farmers about. Where the bulls, normally we test the cows, uh, and the cows are the main show exhibit the symptoms, which is abortions. If the herd is naive, you call it an abortion storm. If you got 100 cows, to have 50 abortions, very easy. Um, in bulls, the difference is the bacteria. This is a bacteria. It localizes in the testicle, and uh, it causes them to swell up. I'm sure you've seen amongst your bulls, sometimes you're looking at the back and then suddenly one testicle is very big and another one is very small. One needs to check for brucellosis if it's not traumatic or any of the other causes. Um, Bulls can also shed that bacteria in the semen, so they can also transmit the disease. For this disease, I think it's controlled, okay? Zambia. Yeah, brucellosis is a very controlled disease in Zambia. Excuse me. Animals should be culled once they are diagnosed positive. Something that's been rearing its head now more and more often is a disease called infectious bovine rhinotracheitis. Big name. Primarily involved in more intensive setups where, like feedlots, where you get mainly the respiratory form. What we have been seeing, I think about 3 years ago, we've had a herd where we saw the virus effect on females. You can just go to that photo here. So if you look at this is something that, okay, not all cows that have an eye that looks like that is IBR. There's many other causes, but one of the symptoms is the eyes. But if you look at, that's the vulva of a cow, and they have these big ulcers all over on the vulva. If you look at a bull, and if he extrude his penis, he'll have lots of ulcers all over his penis. So this is, we saw it on the females. We couldn't pick it up on the males at the time, but this is IBR. IBR right now is becoming a major player in abortion causes all over the world, because maybe because of the more intensive nature of rearing animals, it's being seen more and more in South Africa. It's a major problem now. So yeah, that's the one. And finally, what is the definition of, that was the question we started. This is what we can do in Muda. It must look like a bull, it must walk like a bull. So we don't want any conformation defects. Prepuce must be strong, legs must be strong, all the breed criteria must be correct. You must be able to have a serving capacity or libido. Very, very critical. We have had a few Henry where they just walked away. They just walked away, and you think if a guy looks like a good bull, but he's just not interested. So very, very important. Look at the business end. Testicles must be strong, must be symmetrical, be able to go up and down. You know, bulls don't sweat, right? Bulls don't, or cattle don't sweat. Cows, they control their thermoregulation by the nostril. That's where they control the thermoregulation from. Now, in the case of the bull, if it's very hot, he needs to be able to lower his scrotum. That's why they have muscles, they retractor muscles. Anyway, these are used to control the way the scrotum goes up and down, so that he can control the temperature, because if the temperature goes up, it's going to kill the produce abnormal semen. So we need to look at all these things. You need to palpate the testicles. They must be able to move freely within the scrotum. Then we do a rectal examination, as Amy spoke about. The seminal vesicles, these are organs that produce the fluid that transports the semen. They must be uniform, they must be soft, they must be able to be not inflamed as well. And yeah, that's the end of my presentation, or our presentation. And I'd just like to conclude by saying, thank God they don't have to test us men like that.